If you have cancer and are undergoing conventional treatment such as chemo or perhaps radiation, there's a decent chance you may lose your hair, or perhaps you have already. I say a perfect excuse to get a bunch of fun and crazy wigs and have fun with it, but I get that's not everybody's cup of tea. And really, losing appearance, perceived beauty, which can also be a sign of health, these things take a toll on your already tested emotional state. It certainly doesn't make the whole journey any easier, does it? So, what if I told you there actually is something that can be done, despite what your onc may or may not have told you? There are things that can be done to prevent hair loss, or if you already lost your hair, to get it back even sooner. Hi, I'm Dr. Lisa Matejka, naturopathic physician, energy worker, and transformational life coach, and I help those with cancer navigate their journey back to health and wellness to an even better state than before. That's physically, mentally, emotionally, energetically, and maybe even spiritually. By the way, just in case your doctor did not warn you, so the hair loss, or as it's called, alopecia, it can happen in different patterns and shapes. You can lose it in different configurations on your head. There can be a pattern to it chronologically, timing. You might grow some back in between cycles. It really, really depends on your cycle, treatment, the person, and you also be fair warned, you may also get redness, lesions, perhaps scarring, but it doesn't have to be that way if you do some of these naturopathic and integrative treatments. So first I'll get into what can be done for prevention, and then I'll get in what can be done for treatment, and then I'll even differentiate what can be done for less severe grade 1 and more severe grade 2. So for prevention of hair loss, or at least prevention of, bad hair loss, these are the nutrients you want to focus on, and you can get these from diet, or you may have to supplement these with supplements. So B vitamins, especially B7, which is biotin. And again, you may need to supplement, but some dietary sources of biotin are basically protein, whether animal or plant protein. And then we have, in no particular order, by the way, we have selenium, which you can find in Brazil nuts, seafood. And then we have zinc, which you can also find in some seafood, oysters. Actually, it's usually oysters, some meats, and also pumpkin seeds. Iron is actually an important one as well, and this can be tricky sometimes with chemo. So iron you may have to supplement. Sources can be dark green leafy vegetables, molasses, of course, red meat, beans, dried fruit. Now, not every dietary source of iron or other things I mentioned is necessarily going to be good to eat for cancer. So keep that in mind. I don't usually recommend things like red meat or even dried fruit because of all the sugar. But there's other places to find iron, like I said. So B vitamins, B7 biotin especially, selenium, zinc, iron. Then we have essential fatty acids. These usually need to be supplemented anyways, but you can get some, of course, from fatty oily fish, walnuts, chia seeds, flax seeds, olive oil. And then protein. Protein's really important. And for this, you want to make sure you're getting 0.6 to 1.2 grams of protein per kilogram of body weight. Okay, so basically take your weight in pounds, convert it to kilograms, and then you want to make sure you're getting, multiply that by 0.6, and that's kind of like the minimum you should be getting, 0.6 grams per kilogram of your body weight, but a more ideal one might be the 1.2 grams of protein per kilogram of body weight. So there's that. Okay, this next one for prevention is really cool. Cryotherapy. So cryotherapy. So you wear like this cooling scalp thing, and you do that for, everyone has their own directions. You do that for perhaps 30 minutes before chemo, during chemo, and then, 20 to 90 minutes after chemo. And the idea behind this is it is a cap that is customized to, your scalp, and it's cooled to 32 degrees Fahrenheit. And the idea is it constricts the blood vessels, so it really limits the amount of chemo that reaches that area. And it is said to have a 60% success rate. So 60% of people don't need a wig. They might lose some hair, but 60% of people have enough hair to where they don't need to wear a wig, retain enough of their hair. And so how it works is it's like some kind of refrigerant-based cooling system or a liquid coolant system that is connected to the cap via these like tubes and hoses. So basically, the Mayo Clinic has these, so it's not just, so a lot of places where you might get chemo anyways might have them, especially if you go to like a bigger clinic or a more integrative clinic. But, I don't consider the Mayo Clinic integrative at all. They're pretty conventional and they have these. So you just might need to ask if that's something that is offered where you're getting infused. And if not, these devices can also be purchased. They can be purchased and you can bring them in, or you could find some other practitioner that uses them and see what their system is. If it can be, everybody's different, if it can be borrowed and you can essentially check it out of the clinic and use it, or if you can just use it, schedule right before chemo and after chemo. It depends. So yeah, maybe logistically not the most convenient unless it is offered at the clinic you're at, which a lot of them do, but it's pretty interesting and has a pretty good success rate. Okay, so that was prevention, and now I'm gonna get into treatment. That was prevention, and now this is how to treat it if you already have the hair loss from cancer treatment. And I'm gonna get into grade 1 treatment and then grade 2 treatment. So first, let's start with grade 1. What is that? It's defined as less than 50% hair loss, so not obvious at a distance, but it is upon close inspection. But it's considered to not need a wig for camouflage, but perhaps a different hairstyle. Yes, that's actually how it's defined. So for grade 1, here's all the things you do to treat. You're still going to do the prevention stuff that I mentioned previously, but it's your lucky day because I'm actually going to get into dosing, which I don't always do. Here we go. So B vitamins, the ones you want to focus on are, like I said, biotin B7, riboflavin B2, folate, which is B9, and cobalamin, which is B12. So for biotin B7, you want to be getting anywhere from, this is a range here, you want to be getting anywhere from 30 micrograms a day up to 8 milligrams a day. Next, selenium. That you want about 200 micrograms a day. Next, zinc. That you want about 50 milligrams a day. Then we have iron, if needed. Not everybody needs this, but it's going to be about 100 to 200 milligrams of elemental iron every other day, if needed. And then we have the essential fatty acids. You're going to want to take 460 milligrams a day. And that's actually a pretty low amount because a lot of the dosing for essential fatty acids for therapeutic doses can be like grams. So 460 milligrams, not bad for the essential fatty acids. Okay, so grade 2, treating alopecia hair loss that is considered grade 2 is when it's greater than 50% hair loss, more than half. It is readily apparent to others that you're losing your hair, and a wig is required if the patient wishes to camouflage. And this one is associated with psychosocial impact, so more of an emotional toll, understandably so. There's not as many treatments for this one, I'll be honest with you. Really the best, perhaps only probably not only, but one of the best integrative, more natural treatments for this would be PRP injections, and you only need to get these every 30 days. So platelet-rich plasma injections every 30 days. That's where they take your blood, spin it so it's, it's more platelet-rich, and that inject that is used also times for injuries and helping because it really helps tissues heal. So platelet-rich plasma, PRP injections every 30 days. Otherwise, the treatment is going to be really a drug called minoxidil. So that's not exactly a naturopathic integrative treatment, but it is a treatment, minoxidil. Otherwise, it's wigs, hair pieces, and hair extensions. That's going to be your best bet. There's also hats. I mean, not a treatment exactly, but something that can help to bandage it, a Band-Aid solution until it does grow back, because it will grow back on its own in most cases. So that is that. I hope if you are going through something like this, that was helpful, because not all oncologists are going to mention these therapies, and most of them won't actually. So now you have a little bit of an idea what to expect and how you can help yourself with nutrition, nutrients, supplements, and even some other integrative therapies. So it doesn't have to end here. There are weekly videos I release every Monday for cancer resources to help in all kinds of realms. So I will do monthly videos on something like this, where we're treating a side effect of conventional treatment naturopathically or in an integrative manner. And then once a month, I do guided meditations to help you in a deeper way. Also, once a month, I have a program called Positive Programming, where I give you real life, true inspirational stories of cancer survivors to inspire and rewire your brain for healing. And the other video I do monthly is a wild card. So it could be anything of my choosing in the realm of cancer and natural healing. So so subscribe to this channel, share it with others you know that may be going through cancer as well. All that stuff. Comment, like, it really helps so we can get our message and more people to help. Thank you, and I wish you the best on your cancer journey, and much love.